So welcome to calculations, dosage calculations and math and the way I do it. Now, as I, tell everybody, I don't do ratio proportion. I don't add things, subtract things, and come out with numbers. For me, I think there's more chance of errors. Now, if you use that ratio proportion and that's what you like, it's okay because I'm going to show you how to answer the question that they want. Because I don't think that any question, math question, should be missed. 2 points a question, there's 10 points on every exam. Some of you all have math on your quizzes also. Personally, I don't put it in there, but there are some courses that do. So that being said, let's start out with one of the basic dosage calculations. Now, I'm going to do one-off type of questions from the RN side, and I'm also going to do questions that I've seen from the PN side, all right? So they're similar. Math is math is math is math. So now, let's forget the questions right now and let's go down and look at formulas. Now, there literally is three formulas we are going to use. So when you have a dose that needs to be delivered, whether it's 6 milligrams per hour or 250 milligrams, it is a dose. So you're going to use the dose of over what you were given by the pharmacy, and you're going to give me how much did it come in, whether it's heparin in a bag, 500 mLs, those are still doses. Heparin, insulin, likes per kilo, or just an ampicillin equation are all doses to be delivered. The second equation we use is mLs per hour. How fast am I going to make that pump run? And in that equation, you're not going to see a dose that you have to deliver. You're going to have a volume of liquid that needs to be delivered, and it's going to tell you how long it needs to be delivered over. The one thing students always forget, well, many times, is to multiply it by 60, which is 60 minutes in an hour. And that's how you get mLs per hour. I'll go into this some more. The other one is drop factors or drops per minute. When I first became a nurse, I used to have to count the drops to do my IV and how much am I delivering because we didn't have any IV pumps. This is back in the 70s. I became an RN in 1977. So it is a long time ago. And we didn't even, all we had was a roller clamp, those blue things. Not even a dial of flow did we have. So I would count every 3 seconds a drop would drip. I knew that IV was 125 mLs per hour. Something I don't even know how I figured it out back then. On exams, I do not see many drop factors. Drop factor, drip factor, drops per minute is the same equation as mLs per hour, but instead of 60, you put in the drop factor. Okay, so those are your formulas. Now, the other thing when we're figuring out formulas is to make sure all of the milligrams, micrograms, units, milliunits are all the same. You can't have apples and oranges. So you'll see this down here, kilograms to grams to milligrams to micrograms. That is the way we line up how we're going to either multiply or divide what you have. So that question, 280 milligrams equals how many grams? Well, the milligram is to the right of grams. So to go from milligrams to grams, that means, okay, so it's on the right side, I've got to go to the left. I have to go to the left, I'm dividing by 1,000. And if I'm going from grams to milligrams, I'm going to have to multiply. It's bigger numbers as we go. So you have 1 kilogram, then you got more grams, and then milli is 1,000, it's more grams, and micromillis is more and more. The numbers are bigger and bigger and bigger. Okay, so we'll go over that a little bit as we come up here. So that being said, we have the first question. It's a very upfront, simple sort of question. Now, first of all, we have three formulas. What am I going to use? Is it a dose to be delivered? Is it mLs per hour or drops per minute? Well, this is telling you prescribed to deliver. You need to give. It's a medication. It's a dose. I don't see volume and I don't see time. Do you? No.
Nope.
So what dose do I need to give in number one? Prescribed, order, deliver.
You need to give 82 mgs.
Right, exactly. And they have available, the pharmacy sent 60 milligrams per ml. So let's do that one.
Okay. Can you turn the light back on, son?
I'm sorry.
Okay.
So we have 82 milligrams. That's our dose to be delivered. Never shortcut. Always put down what it is, milligrams, micrograms, mLs, and you'll understand this as we get to more complicated ones. And it comes in 60 milligrams. And you're going to say the quantity is 1 ml, but I'll tell you why I write it there. Anything over itself is 1, so it cancels out. So we know our answer is going to be in mLs. It's the only label left. So all we need to do, you're looking confused. If we have an equation, sometimes you're like, but that has to be an ml per hour question because they're asking for mLs. Well, I'm showing you that the milligrams here cross off. 1 over 1, 2 over 2, it's still 1. Milligram over milligram, gram over gram. They're gone. Cross them off. The only label left is the ml. So we know our answer will have an ml in it. Now, I always tell you to multiply the top numbers. Well, it's 82 times 1, so there's nothing to do there. And just divide it by 60. So let's do that. My grandson hid my calculator. He loves them. All
yes,
right.
they do.
The normal. 80. 82 divided by 60. What did you get? 13.6666.
I got
1.36.
Okay, so it's 1 point. All right.
So then it should be 1.4.
No. Before you do that,
Oh,
go back to the question. What do they want before you do anything? Well, this one doesn't tell you. Usually it will say like number 3, round to the 10th, round to a whole number. This one doesn't. So yes, you can take the 1.33333 and make it, because this number is greater than 5 or greater, it makes that number sitting next to it a 1.4, and that would be your answer. Okay? So rounding is important. Always know it's only the guy next to him that you're worried about. And if it's 5 or bigger, the number to the left always goes up 1. If this was a 4, we're just going to leave it there. 1.3, right? It wouldn't make it to a 1.4. All right, let's get rid of that. Let's go to the next question.
But even though they don't ask you, you still have to put 1.4?
Well, the answer on this one, now, usually on your exams, it'll tell you round to the nearest whole number or
Okay.
round to the nearest tenth. because this didn't say, and it's a pediatric equation, I'll always put it to just to the nearest tenth because there was all of that afterwards. Okay?
Okay.
All right. Number 2. We have the healthcare provider, and I don't ever look at the medication names. Okay? Because they don't make a difference in the numbers. So the healthcare provider orders, prescribed, needs to give, deliver, up, it's a dose, right? Did we figure that out already?
Mm-hmm.
250 milligrams. And the nurse has available, the pharmacy sent, delivered, whatever, is 1 gram, and the quantity is 20 mLs. Now, I don't make any changes until I write down exactly what the equation said. So 250 milligrams, 1 gram, and it came in 20 mLs. And if you notice, I always put it over 1 because I don't want to make it crooked. Sometimes you're writing and things get crooked and you'll multiply the wrong things. Because, as I said, you're going to multiply the top and then divide the bottom. But, milligrams and grams, apples and oranges, it doesn't mix. What do I need to do? Well, I need to change this. How do I make a gram into a milligram? Gram, milligram, micrograms. I go to the
You
right.
multiply.
You
By 1,000.
multiply, right? To the right, you make it bigger. Because remember, milli is 1,000. Milligrams, grams to milligrams. Micrograms is a milligrams, right? So the number's getting bigger and bigger. You multiply the number, it makes it bigger. So
Can I ask you a question?
yes, you may.
Because okay, so you're saying when you move to the left or right, um, and I'm trying to stick with you, but I know like I write mine K, G, M, G, C, G.
Yeah.
So if you go from grams to milligrams, I mean grams to milligrams, it is multiplied, right? I know I said that, but I just want to double check.
You multiply because
Okay.
remember, gram is a 1. Milli is 1,000. So you have to multiply it by 1,000. And as it goes to the right, micrograms
Okay.
would be multiplying by 1,000 too from milligrams. Okay?
Okay.
All right. So we got the grams gone. We got milligrams and milligrams. Oh, and look, milligrams over milligrams, cross out. My answer again is going to be mLs, which is what we want for our answer, right?
Yes.
And what I told you, multiply 250 times 20 and then divide the 1,000. Why do I tell you not just to divide the number and multiply? Sometimes, not all the time, you're going to see you have to round if you multiply and then if you divide it first and then multiply. And
So
why
you
would,
suggest to always do it like that? So take the once you get it
because
like
you
this,
will never have to round.
ever. I'm gonna come back to you now, ever.
No,
Okay.
you don't have to round the answer to 199.999 to 200. You don't have to. It doesn't happen that way.
So
Now,
if it was like 300 over 600 and it was 40 over here, I would take 300 times the 40
yes,
divided by. Okay.
yes,
Okay.
always, just always do it. It just is easier and it eliminates error because you don't have an extra step to do. I'm trying to show you how to do the least amount of steps with the least amount of error. So
Okay.
250 times 20 equals 5,000. And then we divide it by 1,000.
Oh, that's
And our
awesome.
answer is 5 mLs. Isn't that easy?
Yeah, that was beautiful, actually. I never seen it that way.
Okay. That's why I do this. Your Calculate with Confidence book confuses me, very honestly, because a lot of it is, I make it more of a common sense. It just makes more sense this way. All right. Pediatrics always is going to say, what is a dose, right? How much do I need to give? And the reason why it's a dose, you can't give 2 Tylenols. You can't give 1 pill of a blood pressure pill. You can't give a whole anything because everything is weight based. So now we got to figure out pounds and kilograms. Well, what do? Do you multiply or divide by 2.2? Remember this. I weigh 100 kilograms. It's a great number. I weigh 100, right? I'm 200 pounds. Pounds are always more than kilograms. Does that make sense? So if you're 55 pounds, that's the bigger number. I need 0.15 micrograms per kilogram. That's the dose we need to give. So number one thing I need to do is trying to figure out a dose to be delivered, as in not how much mLs you're giving, but only the dose. How much is it saying? So 55 pounds. If we take 55 and divide it by 2.2, because kilogram is a less number, so we divide it down, we get the answer of 25, right? Is that what you get?
Yes.
Okay, so let's go to the board. 0.15 micrograms per kilogram. So we had 55 pounds. We made it into 25 kilograms. And the equation is 0.15 micrograms per kilogram per dose. So how am I going to make my dose? Well, 0.15 micrograms times 25 kilograms is going to equal my dose. All you do is multiply it. So 0.15 times 25 equals 3.75. And that is micrograms. Now, do nothing. Stop, go back, look at the equation, and it is telling you round it to the nearest tenth. 3.75 is now going to equal what after you round it?
3.8.
3.8. Simple, isn't it? All right, let's get a harder question. Oh my God, now we got units. Units are probably the student, I can't do units, I don't understand. They get to units and I don't know. Well, if you don't like units, make it milligrams. Make it whatever you like. Because remember, this is a question that's prescribed to be delivered, ordered. You need to administer 550 units of heparin, insulin, Pitocin, whatever it is. That's a dose. Do you see the dose? And they sent you a bag of 500 mLs, and inside that is 5,000 units. It's like having 250 milligrams and 5 mLs, but this is a bigger bag. This is more volume to be delivered, okay? So the dose is what? Number 4.
5,500 units.
Absolutely. And then the bag has how much units in it?
5,000.
5,000.
And the quantity is?
500 mL.
Look at that. Now, this is heparin, Pitocin, insulin. As I'm saying, if you do not like, what I'm showing you with units, because students go, oh my God, units. Make it whatever you want. Now, I'll put it here as units. This is units you can't abbreviate just to a U, just to let you know. Because remember, units over units are going away anyway. So do you care if it's units, milligrams, micrograms, or anything? Because your answer is how many mLs are you going to deliver? So again, multiply the top and then we'll divide the bottom. So 550, 5,500 times 500. It's a big number. Don't be afraid of big numbers. It's all right. And then we'll just divide it by the bottom number. $550 mLs is your answer. Does that make units, insulin, Pitocin, heparin easier?
Absolutely.
It's a
Thank you.
dose to be delivered. Most students go, I have no clue. I'm going to take a guess. It is just as easy as giving Tylenol, ibuprofen, or an antibiotic. It is pull out my dose, delivered, prescribed, ordered. Okay, let's keep going. Okay. Number 5. Clients to prescribed 250 mLs of 1,000 mLs of D5W over 45 minutes. The nurse will set the pump to deliver how many mLs per hour? Well, every time you get a question, is it a dose to be delivered? Is it a quantity to deliver over time, which is mLs per hour? Or are they mentioning drip factor or drop factor or drops per minute? This is clearly only mLs per hour. Do you see that? And that 1,000 mLs of D5W is a complete distractor just to get you crazy looking at it. What was prescribed? How much did the doctor want you to give?
250.
250.
250 mLs, yes. And the time in minutes that it needs to be delivered?
Oh, it's 45 minutes.
45 minutes. And then always multiply times 60 minutes in an hour. So let's go over this a little closely. So it is volume in mLs over time in minutes. In minutes is the key here. Always times 60. Don't do any shortcuts. Don't ever do that. You guys today have calculators. I didn't have that when I went to nursing school. I had to multiply everything out. So I X'd and crossed whatever I could. You don't have to. So volume in mLs is 250 mLs. This one came in and already told you it's only 45 minutes. And we times it by 60. Again, multiply the top, divide by the bottom. 250 times 60, 15,000 divided by 45. And it's going to be mLs per hour when we are done. Three, 333.3333. We always round that to the nearest whole number, so the answer is 333. And in drops per minute, you can't give a piece of a drop, so it's always a whole number. Is that understandable? Now, what if, because this is the other part of mLs per hour, I want to give 600 mLs over 2.5 hours. Remember, always multiply it by 60. Students forget the 60 all the time. Okay? I always tell you at the beginning of the exam, before you start, write down your 3 equations. Because when it gets to the point of you answering the questions, you're going to forget the equation. Give me 1 second. I got to talk. I love my cable provider. Sorry. They've been keep trying not to send technician here, and I really need them. Anyway, I mean, you guys need me to have good internet, right? You need me to be available, and I'm fighting for it. Okay.
Hey, Miss, I have a question.
Yes.
So, I mean, I guess, okay, why are we putting the 60 over the 1? Because of the minutes? So,
It's
I can't
60
do
minutes in an hour.
50 divided by 45.
What do you mean?
Like, okay, if I put the 250 because it's asking for the dose to be given, and then
Right.
it's 45 minutes, I can't just do 250 divided by 45.
Oh, no. Again, multiply the top, divide the bottom. 60 always has to be there.
Yeah, okay, I see that because when I did that, I don't know why I've been doing it that way. 250, or maybe I don't know.
Listen, I used to divide and then multiply. And especially with mLs per hour, mics per kilo, they're get numbers that I'd have to round. And I don't want any mistakes by something that could be avoided. So if you multiply the top number and then divide, it works out better for you. It's less chance of error.
Okay.
Okay, so you saw how minutes work. There was nothing we need to do, but this 2.5 hours, we have to change it to minutes. So it's 2 times 60 is 120. A half an hour is 30, so it's 150 minutes. Right?
That's right.
So multiply the top, divide the bottom. Let's do that now. So 3, 6, 1, 2, 3, right? Divided by 150.
It's 240.
There you go. And it's mLs that we're given. So when we have hours, convert them to your minutes and then just do the multiplication and divide it by the minutes that you have, okay? That's the difference between, because most of your problems will say, an hour and a half, 2.5 hours, 4 hours. It's not going to usually give you minutes. It's actually, there's nothing to change. So on usually your exams, it'll say like 2.5 hours. Okay. That's why I go over that to let you see it. All right, let's see what we got else here to help you with. Okay. Here is just some IV solutions here. There is minutes here that can show you and hours. These are some examples for you to go and to practice. I have all of your answers here. Now, it's easy to do one where there's no distractors in it. That's not what you're going to see on your exams. You're going to see more like you need to give cimetidine 300 milligrams mixed in this over 45 minutes. And you're like, what do I do? Well, it's not a dose to be delivered. It's telling you time and it's telling you volume. And the volume you're giving is 100 mLs. And how long is it going over? It's 45 minutes. Do you see that?
Mm-hmm.
For instance, number 7, again, showing you another distractor. You don't care what you're delivering. It's telling you there's volume, and cc and ml are the same thing. You put 2 cc's in a 3 ml syringe. I mean, 1 ml and a 2 cc syringe. It's all the same, conversion. You'll see it both letters there, either ml or cc, just in case that problem, was getting you confused. Like number 7, it's telling you something's being done, but it's in 50 mLs of normal saline over 10 minutes. So we would put that 50 over 10 times 60. Do you see that?
Yes.
Okay, does that make sense for everybody? mLs per hour, you're definitely going to see. You're definitely going to see figuring out a dose like number 3 here, which is you've got a child this, how much am I going to give? Sometimes they'll give you another step. And that other step might say, and they have available on hand 2 milligrams in 4 mLs or 5 mLs. And then you'd figure out the dose. But how much mLs to give. This one, number 3, is just a dose. How much is it? How many micrograms to be delivered? But remember, it might be another step. Figuring out the dose and then figuring out mLs per hour. All right, let me go to something else that is, are any of you in med-surg too?
I am.
Yes, me.
Okay, are you doing things with mics per kilo per minute?
We
Type
do
of,
not do any math on med-surg yet.
okay. There is some information. I'm quickly just gonna show you something. Where is it? Let's go.
Oh yeah, actually, I have a quiz coming up Friday that's gonna have infusion rates on it.
Infusion rates in, okay, and that is milligrams per kilogram.
I don't know.
Okay. Well, infusion rates could be mLs per hour, or it could be that you need to give a medication. These medications are usually what we call a drip. These are usually critical care type things where
Oh,
you're
the
getting
GTC.
lidocaine, or which helps with cardiac arrhythmias, or nipride, which brings the blood pressure up. Okay? Or aminophylline helping you breathe. It's a slow, continuous drip of medication to do whatever purpose it is. There's usually a main IV with it. Now, how do we figure these things out? Now, they're like, oh my God, I don't know what to do with it. It's just too much. Well, again, They're all giving you a dose to be delivered, aren't they? There's all a dose. Number one, simply, they gave you a bag of whatever. It has 1 gram and 500 mLs, and they want you to deliver it, to give it at your dose is 3 milligrams per minute. Did you see how easy that is? So now we have a dose is 3 milligrams per minute. Now, it came in a bag and it has 1 gram and the quantity 500 mLs. That's how easy it is for you to do mics per kilo, milligrams, micrograms, units, microunits per minute, per hour, does not matter. Again, it's a dose to be delivered. You need
Is it possible you could write that one out just so I
I'm
can
going to. Absolutely. And then I'm going to go into the most evolved one, and it's just plugging in numbers and all it is. So our dose, they want you to give 3 milligrams a minute of whatever it is. And they sent up a bag which had 1 gram, and it came in 500 mLs.
Oh, that's a quantity. Okay, okay.
Okay. So again, remember, I'm keeping everything so it's not awkward and cockeyed, right?
Okay.
Now, they want the answer mLs per hour, don't they?
Yes.
This is a minute. We have to times it by 60. We need to make that an hour. If it's 3 milligrams per hour, you do nothing. If it's not an hour, this is apples and oranges for this. They don't mix. Just like milligrams and grams. So if I want to go from grams to the right to milligrams, what do I do?
Divide. I mean, multiply.
Exactly. So 3 milligrams times 60 to make it an hour, get rid of that minute, over 1,000 milligrams times 500 mLs over 1. Now, you want mLs per hour. Let me show you how you got that. Milligram over milligram crosses out. The only thing I have left is mLs per hour. So I'm going to get the answer. Students say, well, why isn't it the ml per hour formula? Well, you crossed out the milligrams, units, whatever it is, and it ends up being mLs per hour. So again, just multiply the top, the whole thing. And as we get to mics per kilo, per minute, it's going to be more and more numbers, and the numbers are going to be bigger, and that's okay. 3 times 60 times 500. And we get 90,000. Divided by 1,000 equals 90 mLs per hour. Was that easier to look at?
Yes.
Very easy. Now, let me go to the most complicated one, and then we're stopping there today. It's plenty for today. All right, number 2. Well, number 2 has an equation. Again, we're going to look at it. Is it a dose? Is it mLs per hour? Does it have time? And does it have a quantity? Or does it have drop factor or drops per minute? Well, this is a dose. It says ordered to deliver at what?
500 milligrams.
What is 500 milligrams? It's in 250 mLs. That's what you have.
Oh, that's what I'm looking at. Okay.
But it's going to run at what? At 2 micrograms
Per
per
kilogram
kilogram per minute. And they gave you a bag, and it has 500 milligrams in it. And it's in 250 mLs. So again, make sure you have all your labels, write them down, and let's write them into that formula. Wait a second. I got to figure out one last thing I didn't check. How much does this person weigh?
12.5.
125 pounds. So there's a
Do you mind if
lot
I
of
just-
different things we have to do here to fill it in.
Do you mind if I verify something with you real
Sure, go
quick?
ahead.
So it's if you are in pounds, you divide by 2.2. And if you're in
Yes,
kilograms, you multiply by
right.
2.2. Okay, perfect. Thank you.
Because remember, I only weigh 100 kilograms. I don't weigh 200 and more pounds because
Mhm.
that's more. So I like them 100. That's a great number, isn't it? I think so.
Thank you very much.
I haven't weighed 100 since I was what, 10? Okay, here we go. So it's 2 micrograms per kilogram per minute. Just write it down like the formula. Don't do any changes. Don't try to write it down and change as you do it. Errors happen then. And 500 milligrams was in the bag, and that bag was 250 mLs big. And this person weighed 125 pounds. So let's go down and rewrite it down. 2 micrograms times 125 is how many kilograms?
Um,
56.8. And remember, we want mLs per hour again. That's what our question's asking for. So minutes we don't need. We need an hour. So we're going to make that a 60. If it's already 2 mics per kilo per hour, you do nothing. If it's minutes, it's when you multiply it by 60. All right, times 250, we're good. Uh-oh, micrograms and milligrams. So milligrams to micrograms, do I multiply or divide?
Multiply.
I'm going to the right. I'm going from milli to more than that, micromillis. I'm getting bigger. My number, I multiply by
Multiply.
1,000. When I was learning this, I would always write this down like this before I took an exam. So if I'm going to the right, I know I'm going to multiply. And if I'm going the other way, I'm going to divide. That's something that I would always write, so it's a visual, so I will see it. Make sense? All right, let's look at this. Micrograms come off. Got the 60 in there. So 2 mics per kilogram times 60 times the volume. And then I've got the labels are all the same. And now I'm just going to multiply across, and then I'm going to divide. And the number's going to be big, and don't be afraid of it. What I always say with big numbers, always do it twice on the calculator. I've got nails that hit and pudgy sausage fingers, and I'll get wrong numbers, right? So 2 times 56.8 times 60 times the volume of 250. All right, I got 1704000. I'm going to do it again, make sure. 2 times 56.8 times 60 times 250 equals. Oh, and you cleared out on me. Not nice. One 704,000. And I'm going to divide that by 500,000. And my answer is 3 0.4. And that's the answer. That's the most complicated of all the mics per kilogram things. And it's just filling in the blanks. Just known as mics per kilo per minute. Oh, I want hours. Let's change it. And make sure that all of your milligrams and micrograms are the same. Everything's the same. And again, multiply the top, divide the bottom, and you'll get your answer. How does that feel better for all of you?
Yeah, it was good.
Definitely, thank you.
Yeah, I was gonna. I'm gonna rewatch it a little bit probably tomorrow. But
Watch it again, and remember, I have other ones out there. I go over some of the same things. They all just, it's the same repetition. And again, I sent out a bunch of worksheets, and I believe your professor sent them. Just work on them. I put all the answers on all the worksheets.
Okay.
If any of you still are like, I don't get it, just please send me a message. I'll work with you on 1-to-1 or 2-to-1. Okay?
Okay, thank you.
You're very welcome, guys. You have a great day and
Thank
good luck
you.
next week.
All right, thank you.
You're
Thank
welcome.
you.
Bye.